And you want to put yourself on mute until we get started. Thanks. Welcome, everyone. Good morning. Thanks for joining us for this session on Bingocize. I don't know how many of you were able to attend the demo last night, but it was a lot of fun. So I'm sure we're in for an interesting session this morning. I'm Jean Van Ryzen with NCOA, and I'm the moderator for today's session. Just a reminder to please put any questions you might have in the Q&A area, which is located along the bottom of your screen, and we will answer them at the end. Let me introduce our two speakers this morning. We have Dr. Jason Crandall, who is Associate Professor and Director of the Western Kentucky University Center for Applied Science in Health and Aging, and he's also the creator of Bingocize. And we have Allison Goforth, Program Director in the Community Wellness Department at Partners in Care Foundation based in Southern California. Jason, take it away.
Thank you, Jean. I really appreciate it. And thanks everyone for being here this morning. And so as Jean indicated, we're here to talk about Bingocize. And so we're just going to get right into it. So first off, these are lists of things, benefits that we know can be achieved through chronic physical activity. I'm sure most of you have seen these benefits. You're very familiar with these benefits. And really the point of this slide is to kind of show the scope and the breadth of what physical activity can do for older adults. It's really amazing, all of these benefits from just being physically active. In particular, what we know can come from chronic physical activity is a reduction in falls. And all of us know that falls are a real problem right now in the United States and across the world. And for many reasons. One, first being the cost. It's extremely expensive when older adults fall to treat those injuries and the ramifications of the falls after they happen. Also, it's a horrible impact to quality of life. And a lot of older adults are falling. About 25% of older adults older than 65 will fall each year. The good thing is that a lot of these falls are preventable. And the CDC has a really great program that you may or may not be familiar with. It's called the STEADY program. It's Stopping Elderly Accidents, Deaths, and Injuries. That's what STEADY stands for. And really it was designed initially for clinicians to assess their patients and look at their fall risk. And based on that assessment, they would recommend that they either go to therapy or that they be referred to an evidence-based program that many of us are familiar with. So in 2019, Vincenzo and Patton actually looked at a group of older adults who had gone through the STEADY program, who had been assessed by their physicians, and they wanted to see how they were adhering to those particular recommendations. And what they found was 79% of those people accurately recalled actually having the risk assessment, so that was a good thing. 32% didn't recall any of the recommendations that they were given. So, almost a third didn't remember anything. No participants recalled or adhered to the recommendations, including medication review, taking time to change positions, vision checks, visiting podiatrists, or physical therapy. Of that group that they assessed, 32% of those people fell. And of those people, 56% had not followed any of the recommendations that they were given. So over half. The good news was 57% followed one or more of the recommendations. And the recommendations they followed often was exercise, which that's great. Unfortunately, not all of them are doing that. And so we still have some work to do. And so when we're looking at the amount of physical activity that's recommended for older adults, we really have some guidelines here. So we want older adults, just like the population that's younger than older adults, we want them doing 150 minutes of moderate to intense activity every week. and we want them doing some kind of muscle strengthening activity at least a couple of days a week. So those would be the recommendations, really, to prevent chronic disease risk and hopefully to prevent some of those falls that we talked about earlier. Unfortunately, many of the older adults in the country are not meeting those recommendations. They're not getting enough. So these are data from 2017. And as you can see, as a whole, the United States is at about 17.6% of older adults meeting those recommendations. So the vast majority are not. If you look at specific parts of the country, they're not doing well. So I'm in Kentucky, and as you can see, we are at about 11.6%, which is really, really bad. And it looks like the South is just not doing very well at all. You guys out west are doing much better. But even out west, where Allison is in California, it's still, a quarter or less of the older adults are getting that recommended amount of physical activity. Well, the question would be, we know it's great for us. We know older adults should be doing it, but they're not adhering to it. And so Devereaux and Fitzgerald in 2016 reviewed about 2,600 papers looking at why older adults were actually exercising. Why were they doing it? What were some of the reasons that they were doing it? And what they found is that the interventions that were working were capable of overcoming the older adults' doubts and fears. Fear is a really big reason that they're not exercising. They were able to create social connections. So social connection is a really big factor for older adults in exercise. And, it couldn't be even more important right now with everything that's going on and older adults being socially isolated. So social connections are important to them. It's important that it's led by a knowledgeable instructor, which kind of ties back to them being afraid of exercise. So they want to be sure that whoever's leading them knows what they're doing. And then the last one, but I think probably one of the most important, is that it has to be fun. They have to have a good time doing the exercise program, or they're not going to come back. They're not going to adhere, and you're not going to retain them. So these are really, really important factors when you're looking at designing effective exercise, physical activity programs. So that's kind of where Bingocize comes in. So the next slide is a video I'd like to show you that kind of gives you an overview of what Bingocize is. It kind of shows the program in action. And so we'll just show that and then we'll talk.
An example of a steady step stool is a chair that's true.
Exercise can help prevent chronic diseases and falls in older adults, but unfortunately, less than 15% of older adults exercise regularly. Many older adults report that traditional exercise programs are not enjoyable, leading to inactivity and related health issues. Bingocize offers a unique solution that mixes exercise, health education, and bingo to help overcome health problems and participants across the entire spectrum of care. It's completely adaptable for all types of facilities and is beneficial for all ranges of physical and mental ability. Evidence shows social, cognitive, and physical improvements. And the best part, it's fun. There are two ways to play Bingocize: the traditional version and using a mobile app on any electronic device. Both versions are led by trained leaders utilizing the contents of Bingocize in a box. Bingocize is a fun, affordable way to improve health and quality of life. For more information, visit our website at www.bingocize.com.
Sorry. So that kind of gives you a little bit of an overview of what the program looks like in action. And as it mentioned, there are really two delivery mechanisms, as I refer to them, for Bingocize. We have the more traditional delivery where the folks are in a group and they're using a traditional bingo game using our curriculum, or they can be face-to-face in a room using tablets and each one has a tablet, and the facilitator uses a tablet to facilitate the program, and they play that way. With the COVID crisis, we have tweaked the program a bit to be delivered remotely, which I'll talk about a little bit later on. So because of the evidence that we have, we've collected, we went through the approval process, and we are approved as a fall prevention program by the NCOA. So many of you are currently using the program, but those of you who aren't, because it does meet the evidence-based criteria, Title III-D money can be used to license the program. It also has been approved as an obesity prevention program by SNAP-Ed. So if you are involved in the SNAP-Ed program, you can use those dollars as well to purchase Bingocize. So just a little bit more of the nuts and bolts of what the program looks like. So we have 3 units. We call them units. Each unit is 10 weeks, and they meet twice a week. The first unit is a bingo and exercise unit. So it's just bingo and it's just exercise. The second unit, it combines bingo, exercise, and fall prevention education. And the third unit is bingo, exercise, and nutrition. Again, each one of those units is 10 weeks, twice a week. And as you notice, they all include exercise because we got to get that exercise in there because it's so very, very important. So these 3 units really gives you options. So you can choose whichever unit you would like to use at your facility for your specific group. We recommend that you kind of alternate, maybe do the bingo exercise only, take a break, maybe do one of the other evidence-based programs, maybe come back and do the fall prevention, and so on. So you can really mix and match how you present your units. All of the curriculum materials are located on the online training site, which we'll talk about in just a minute, which really gives you easy access to be able to print out all of the facilitator materials, the participant materials, and so on. So what you're seeing now, this is one of the things that we have as part of the program. It's a take-home card. So we realize that the 2 sessions a week of Bingocize aren't really going to get them that level of physical activity that we know they need. So we want to encourage them to do physical activity outside of the program. So at the beginning of each week, these take-home cards are sent home with the participants. And if they do these certain things, then they can bring the card back and they can get a special prize for doing those things. So we encourage them to be doing these exercises. If the take-home card is part of one of the education units, the fall prevention or the nutrition, then we ask them to do things related to that particular topic. So we're trying to reinforce that curriculum. This card is a fall prevention card, and so we ask them to go home, review their home, remove any clutter to try to reduce the fall risk. And of course, we do fun things like, hey, invite a friend to Bingocize so they'll come next time. So I think another really great thing about the program is that we have used it across the spectrum of care. So most of you here are probably working with people out in the community that are independent living. And so we've definitely done that. But we've also had the program in assisted living and dozens and dozens of long-term care facilities as well. So if you have colleagues that maybe work in those areas, you can let them know that Bingocize has been used in those facilities as well, and it works really, really well. You can see that the older adults in the long-term care really, really enjoy the Bingocize. So because it is evidence-based, we have been able to do quite a bit of research, and we have quite a bit of research funding. Two big ones that you'll probably recognize will be the NIA, the National Institute on Aging. We're currently conducting a clinical trial, particularly using the mobile app, and we're about halfway through that trial right now. And we also have funding from the Center for Medicare and Medicaid, and that is specifically to implement the program in those long-term care facilities. So we have it right now in Kentucky and in Tennessee, and we're working on other states, particularly down in the South at this point. So overall, looking at the evidence base, you can see we've studied a lot of outcomes for the program, a lot of physical outcomes. As you can see, we've improved lower body strength, upper body strength, cardiorespiratory endurance, balance, all of those things that are really, really important to reduce fall risk. We've also looked at the health knowledge piece, and we have definitely significantly improved health knowledge about those topics pre and post. And at the very top, you'll see that we have actually found some improvements in executive function, which is a piece of cognition. So I work very closely with a cognitive psychologist who measures these participants in our research, looks at cognition pre and post. And so we have found that we've had some improvements there, and we're looking at that right now in our NIA clinical trial as well. So because we have the evidence, and it is approved by the NCOA and SNAP-Ed, we have been able to disseminate the program to 35 states right now. So the states in red has Bingocize, and so my goal is to kind of fill in all these gray states. So if you're out there in one of these states, I invite you to launch a Bingocize program. So there are specific materials that go with the program. So we do have what we call Bingocize in a box. And so in that box is the equipment, enough equipment for 20 people. And so with a license, we will ship you one of these boxes, and it's in a nice sturdy plastic box, so you can put it up whenever you're not using it, and it lasts you a long time. You can see there's therapy balls there that we use a lot for hand grip strength. The older adults really, really comment about how they really like that their hand grip strength is getting better, which really helps with ADLs and IADLs. We also have t-shirts available. So with the box, there's 1 liter t-shirt, and those are black that comes in the box. But we also have optional t-shirts for the participants. And on the back of the t-shirts, it says, "I'm a Bingocizer." So there's really a specific research base for those t-shirts, because we know that individuals who feel a part of a group are going to be more likely to adhere to that particular program or that particular group. So it really makes them feel like they're a part of the group. And so we've really seen this in the long-term care facilities, where those people, once they get their shirt, they wear it all over the facility, and they really feel a part of that particular program. And it really encourages them to come back the next time. We also have as a part of the program, we're a partner with Fresh Baby, and you probably have heard of Fresh Baby by now at this point in the meeting. And so we work with them to provide prizes or curriculum reinforcers, if you're dealing with SNAP-Ed, for the program. Of course, it is Bingocize, so prizes are important. We like to promote prizes that reinforce the curriculum, and that's kind of where these nutrition-focused prizes come in. So we do provide those. But we have a lot of facilities that choose to use other types of prizes like personal care items, small soaps and lotions and things like that. And it really depends on the facility. That's kind of what we have found, that it's really all over the board. But most often it's personal care items. It's things that the older adults really don't want to purchase with their own money. And so those make great prizes. But as you can see, these nutrition-focused prizes, they really, really like those. And especially if we're talking about hydration in the nutrition unit, it's really great to give away a water bottle to really reinforce that hydration. I think the other really important thing about Bingocize is we provide an all online training. So there's no travel required here. You just you get a link to the training, you register, you get onto the training, and it's all done online. It's asynchronous, so you can take it whenever you want. There's 5 modules. Each module can be taken separately. So if you don't have a lot of time to take all 5 at one time, you can take each one individually. So this is a screenshot of what the online training looks like. And so these are some of the screens. So the modules really focus on aging and physical activity, so kind of giving you some background there. How do you lead and assess the Bingocize session? How do you set up the room in order to do Bingocize? We talk about a lot of safety issues, of course. And then the most important part would be really the exercises. So we give you a really good description of each exercise that's included in the sessions, including videos. And all the videos are, the demonstrators are all older adults. So you can make sure that they see a model they can relate to. And so if you're using the app version, of course, those videos are always there. You can watch those as you're playing using the app. If you're not using the app, the videos are still all available anytime you want by just going right back into your online training, and you can look at the videos and you can review those videos. And we would even give you a link to those videos, so that if you wanted to maybe show the video up on a smart board or using a PowerPoint projector, you could do that as well. Another screenshot looking at the different types of exercises. So you could just click on those icons and that would take you to the video. There's the different hand exercises that I was referring to. And then of course at the end of the training, you will complete an assessment. If you get 80% or above, then you're able to print off a certificate of completion. And that would certify you for 2 years, and then you would recertify after a couple of years. Earlier, I mentioned that we do have a new remote delivery. So the app was always designed to be used to deliver remotely, but pre-COVID, everything we had done to that point was all face-to-face still. Each person had a tablet, but they were still all face-to-face. And so when COVID happened, we were getting a lot of inquiries about, hey, can Bingocize be delivered remotely? And so we started thinking about ways that we could take what we already had and do that. And so really we came up with 3 separate options. All of these options require the older adult to be able to use Zoom, GoToMeeting, or some other video conferencing platform, which if you have tried that, some older adults have some issues with that. But if they can get on, then you could use the traditional version, which was basically you are on camera using a traditional bingo game. They're at home and they're doing exactly what they would do if they were face-to-face with you. Of course, you would have to get them the cards and the participant materials, but that's definitely possible. The other option would be to basically use the mobile app exclusively. And if you joined us last night, that's what we were doing. the participants last night were logged into the app. I was using Zoom, and so it could be delivered that way. That presents a few problems for many people because, of course, they have to learn how to use Zoom, and then they have to log on to the app, which is really simple to log on to the app. But if you try to have multiple screens up, you can understand that an older adult could have a few issues closing and opening different screens and moving those screens around. So what we have discovered is a hybrid version of these two has really worked the best. And I think Allison will talk a little bit about that later. But in that hybrid version, basically what we're doing is still using Zoom, still using a video conference platform, except the facilitator is sharing their screen, showing the app screen, and the participants have a Bingocize card, and those cards match what they would see on the screen if they were actually just using the app itself. So all they have to really know how to do at that point is use Zoom. They don't have to manipulate other screens. And like I said, I think that has worked best for some of the organizations that are doing this currently. And I'll let Allison speak to that as well. So now I'm going to turn it over to Allison, and she's going to talk about her experiences with Bingocize.
So I'll start with a little overview of what we do at Partners in Care Foundation. We have over 20 years of experience delivering programs and services that support the needs of older adults and adults with disabilities. Our mission is to shape the evolving health system by developing and spreading high-value models of community-based care and self-management. And that's a little bit of a mouthful, so I'll tell you exactly what that means for our department. Next slide. So I work in the community wellness department. We focus primarily on evidence-based wellness programming for older adults. So at the moment, we offer 10 evidence-based programs to residents of Los Angeles County. And kind of for reference, we serve about 2,500 people every year with these programs. And that shakes out to about 250 workshops per year. And of course, one of those programs is Bingocize. So that's what I'm here to talk about. Next slide. So we started our first Bingocize workshop in October of last year, so we're still kind of new to it. We've completed 5 in-person workshops since then, with a little caveat that 2 of those workshops had to be canceled a little bit early because of the COVID pandemic, but we still got to 18 sessions with them, so we did consider them complete. But the participation numbers you see here are actually from the 3 that we finished entirely. So of those 3 workshops, we had 33 participants. 22 of those were completers. So that averages to a completer rate of about 67%. That might sound a little bit low if you're used to talking about evidence-based programs like the Chronic Disease Self-Management Program or something like that, but just keep in mind that Bingocize is a little bit longer. It's 20 sessions over 10 weeks. So for comparison, the Tai Chi for Arthritis evidence-based program is also 20 sessions over 10 weeks, and it has a national completer rate of around 30%. So at least for us, we're finding that the Bingocize has a bit of a higher completer rate than we were expecting. We have also taken a number of evidence-based programs to remote formats, both online and telephonic, and we're currently underway with 3 online Bingocize workshops, and we have a total of 20 participants in those 3 workshops. We're also going to be starting a 4th next week, which we're pretty excited about. So it's going pretty well. In total, we have 5 trained staff facilitators, and we are planning to continue to ramp up our Bingocize programming in the years to come. Bingocize is covered under our Title 3D grants. We have 2 of those, as well as the 2 community development block grants that we have for Los Angeles. And we also just received notice that we were awarded an ACL grant for falls prevention that includes funding to help ramp up Bingocize in the entire state of California. So we're really excited about that. Next slide. All right, so a little more on the practical side, some challenges and solutions. First is the allure of bingo, right? It's a challenge. It's also a really wonderful thing. Sometimes participants will show up to the workshop hoping just to play bingo, or sometimes just to exercise, depends on like what they took from, you know, our marketing material. And we have to do a little smooth talking to get them down for the other activities in the program. But, you know, we do that just reminding them this is an evidence-based program. You know, there's a lot of benefits to participating in both the bingo and the exercise, as well as, of course, the health education piece. So usually people will get on board. Most people don't walk out of a bingo game no matter what. So it's worked out pretty well. Another challenge we've had is funding the prizes. It can be a little bit tricky to convince funders to allow you to purchase prizes depending on where your funding comes from. We've been fortunate. We've had conversations with our grantors who have been very understanding and have allowed us to purchase prizes with grant funding as workshop supplies. And in cases where the grants don't necessarily cover the cost of prizes, we've also solicited donations from companies that offer like health-related items such as pillboxes or nutrition products. So we have been able to cover all of those prizes. Another challenge is, as I mentioned, it's 10 weeks, and that can be long for a lot of people. It can also be difficult to schedule for 10 weeks on our part. As I mentioned earlier, we do provide about 250 workshops per year, so it takes a lot of finagling everyone's schedules to make that happen. So after a little bit of trial and error, we kind of figured out, you know, 10 weeks is one of our longer programs, so let's just schedule those Bingocize classes first, and then we'll plan other things around them, and that's worked out pretty well for us. Most of our other programs are 6 to 8 weeks, so they're a little bit easier to slap on a calendar. And also, you know, 10 weeks is a long time to keep people engaged. But again, that's the beauty of bingo, is that people come back because it's fun and there are prizes. It's also a really social program. So, you know, there's a lot of room for joking around and getting to know each other. And that's been a real benefit for our participants. Next slide. All right, so just kind of an overview as from my perspective as a community organization. Bingocize is really easy to get started. As I said, we have 10 evidence-based programs, and I'd say Bingocize is one of the easiest to get rolling with. It's pretty cost-effective, especially again compared to some other evidence-based programs. Jason and his team is awesome. They have been a great support to us. They're very responsive, always willing to answer questions, you know, jump on Zoom or a call to explain something we may not understand, give suggestions for, you know, where we might be able to purchase prizes. So they've been really amazing and have made this really easy for us. The tools are also really easy to use. The leader's manual walks right through the material, so there's very little margin for error there. And the mobile app is really easy to use once you get on it, and even getting on it, if those of you who participated yesterday in the Bingocize session, hopefully it was pretty easy. We found it pretty easy to get participants up and running. And everybody loves bingo. I've said it a few times, but I'll say it again. Bingo is a real allure to people, and it gets people in the door and keeps them there. So overall, it's been a really good experience. Next slide. I hand it back over to Jason. Oh, Jason, I think you're still on mute.
Yes, I am. Thanks, Allison. I just wanted to point out something that Allison said about bingo. Everybody does love bingo. And one of the things that we have really did from the very beginning of the program is that we told people as we were advertising it, that they could come to Bingocize and not exercise, which really sounds counterintuitive considering it's an exercise program. But what we typically find, and it's almost 100%, is that once someone gets there with just the intent to play bingo, is they will start to participate in the exercise. Just because they have that group cohesion, and they start to want to be a part of the group, and they want to do what everybody else is doing. And so I think that's one really good draw for Bingocize. It really gets people who aren't physically active doing something. It can be modified to be more intense, of course, but it's really probably not for those people who are doing Zumba or the more high-level kind of physical activity. And that's fine. Those folks can keep doing those types of programs. Those are great programs. But I think Bingocize is more of a stepping stone for those people who, if the numbers are correct, it's the vast majority of older adults who aren't doing pretty much of anything. So it helps them to get started and kind of move them along and get them being more physically active. So I'm sure one of your main questions so far is, what does it cost, and how does that work? And so this next slide just kind of goes through the cost, and all of this information is available on our website, and I will give you that in the next slide, so you can go to that website and review how the pricing works. But basically the way that we do it is each county is $250 for a couple of years, and that would give you access to use Bingocize in an unlimited number of facilities within that county. So no matter how large or small your county is, it would be $250. For example, in San Francisco County purchased the license, so it was $250 for the entire county of San Francisco. So really good deal for them. We do have statewide licenses available. And so Kentucky and Tennessee, for example, have statewide licenses that allow any senior center in the state to use the program. For those of you who have a lot of counties, we do have a discount if you have more than 10 counties. And so it's a 10% discount. So just an example how the license would work. If you had 3 counties that you wanted to be able to use Bingocize in, it would be $750. The training, again, is all online, and it's per person. So each person is $150, and that would get them trained for 2 years, and then they recertify after a couple of years for $75. We do provide the Bingocize in a box, as I mentioned, and that's $250 plus shipping. So 1, 2, and 3 are required components of the program. So those are kind of a must. And the 4th are optional items that we have available. They're not required, but they are there, and they're very, very helpful. The mobile app we've already mentioned. We have a really special price on the mobile app of $50 per license, and that means you could use the app as much as you want for an extra $50. So it'd be $300 regular license plus $50 add-on for the mobile app. And right now, if you have an existing license or you wanted to get a new license, we would basically allow you to use the app for free for the next couple of months. We've done that for the past, I guess, couple of months now in response to the COVID crisis, because we wanted to make sure that people could use Bingocize, especially remotely, and so that's what we've done. The t-shirts that I mentioned, those are $15 a piece. And the prize packages that I mentioned, we have different dollar amounts for the prize packages, and those all come from Fresh Baby. And so each dollar level gives you a certain number of prizes that you can use to give out during the Bingocize program. Again, those aren't required, but they are extremely helpful and really, really reinforce the curriculum that we're trying to teach them. So I think take-home message, I think Of course, we all would agree, I think at this point, that habitual physical activity can definitely help prevent falls and fall-related injuries. The big piece to that is we've got to make sure that they adhere and that we can retain them to the program. That's critical. If they're not showing up, they're not going to get any of those benefits that we talked about at the very beginning. They've got to make sure that they're coming. And I think Bingocize can do that. And because we have it in different formats, and it can be delivered across the spectrum of care, it can really impact a lot of people in a lot of different situations. And so I think we give you multiple ways to deliver it, especially now, how it's really important to be able to deliver things remotely. And so it really encourages older people to move, I say move their way. So however they like to do physical activity, because it's social, we are attentive to their needs. We make sure that the exercises are safe, that the facilitators are trained and know what they're doing. It's fun, of course, that's a biggie, and the environment is really conducive